and welcome to Authority Health GME Consortium's 2021 virtual graduation. My name is Angela Cole. I am the Administrative Director for Graduate Medical Education. It is my pleasure and honor to welcome you to our virtual celebration in honor of the class of 2021. This marks Authority Health's second virtual graduation during these unprecedented times. We have all continued to thrive through these challenging circumstances, making the necessary adjustments to meet the needs of those Authority Health vows to serve. And celebrating our graduates safely via this virtual platform is no exception to the adjustments we all have made in order to stay safe and keep others safe. We are proud and happy to gather in this way to acknowledge our graduates of this very great accomplishment and milestone in their growing careers. So please enjoy the messages. I wish you all graduates much success, prosperity, and good health. Take care. Keep in touch. And with that, I would like to present to you our DME DIO for Graduate Medical Education, Dr. Ernie Yoder.
Hello, I'm Dr. Ernie Yoder, the Director of Medical Education for the Graduate Medical Education programs at Authority Health. It has been my honor to work with you all for the past 3 years. I want to thank you for your compassion in serving our patients and their families. I want to thank you for your spirit of volunteerism and for your courage in facing the COVID-19 pandemic. I want to thank you for persisting as we swabbed hundreds of our neighbors to test for COVID-19. I would like to remind you of the uniqueness of your preparation for practice. Through our Population Health Certificate program and community medicine rotation, you are well prepared to meet the needs of individuals and communities wherever you choose to practice. I hope you will never forget your colleagues and peers as you move on in your career. I challenge you to continue to live our values, assuring healthcare access for the underserved, remaining accountable for quality and safety of healthcare, promoting diversity and social justice, partnering with community organizations and agencies to provide great care for your patients, and for committing to preventive care for all of your patients. Please continue to listen to your inner voice, that voice that urges you to take action on behalf of your patients and community, wherever that may be. Finally, I want to thank you for helping us to achieve our mission of assuring the healthcare safety net for the residents of Detroit, Wayne County, and Southeast Michigan. I would like to close with 2 relevant quotes. Tom Brokaw said, "You are educated. Your certification is in your degree. You may think of it as the ticket to a good life. Let me ask you to think of it as an alternative. Think of it as your ticket to change the world. Watch your thoughts. They become words. Watch your words. They become actions. Watch your actions. They become habits. Watch your habits. They become character. Watch your character. It becomes your destiny." Words of wisdom from the great philosopher Lao Tse. So I want to congratulate you on your achievements and wish you the best as you continue your career. Now it is my pleasure to introduce Authority Health's President and CEO, Loreta V. Bush, who will be offering remarks.
It gives me great pleasure to bring greetings and congratulations on behalf of the Board of Directors and the entire staff of Authority Health. We are honored that you trusted us to provide the best teaching health center experience and to prepare you to fulfill the primary care needs of our nation. This has been a difficult year for all of us. Some would say it was the best of times and it was the worst of times. I'm sure the experience of providing clinical care during a deadly global pandemic has taught you things you never expected and likely will never forget. We commend you for your selflessness, your determination, and your courage as you stood on the front lines in these worst days of COVID-19. The civil strife that resulted from the murders of George Floyd, Breonna Taylor, and others, along with the hate expressed in the political campaign, created a toxic social environment that affected both the physical and mental health of many. You took those occurrences and challenged Authority Health to do more than produce a written statement on diversity and inclusion. The curriculum on anti-racism and bias will forever be your gift to the residents that come after you, and a proud legacy that you helped to create here at Authority Health. Most importantly, we thank you on behalf of all the lives you have touched during your time in Detroit and the surrounding areas. You have practiced medicine through a lens of addressing the social determinants of health and trauma-informed care. You have strived to understand the true essence of underserved populations and what it takes to build healthy communities. As a physician, you are a respected member of the community. You have the power to influence public opinion and policy making. We challenge you to not stop at just being an excellent provider of clinical care. Also be a leader in promoting health equity and social justice. I'll leave with you this quote: "There is nothing more beautiful than finding your course. Wouldn't you know that your path was there all along, waiting for you to knock, waiting for you to become. This path does not belong to your parents. It doesn't belong to your teachers. It doesn't belong to your leaders, nor your lovers. Your path is your character defining itself more and more every day, like a photograph coming into focus. Go forth, continue to make a difference in the world, continue to be the difference that this world needs. We're proud of you and we'll miss you." And now it is my honor to introduce a true advocate of the Graduate Medical Education Teaching Health Center, U.S. Senator Debbie Stabenow of the great state of Michigan.
Happy graduation day. Congratulations to this year's graduates and all of the teachers, family members, friends, and community members who helped you reach this day. Over the past 14 months, we've seen just how crucial this training is. I know that each of you who are members of this program have made a huge difference on the front lines of the COVID-19 pandemic. You've met people where they are, you've offered compassionate, sensitive care, and you've literally saved people's lives. That's why I'm so glad we were able to extend the Teaching Health Center Graduate Medical Education Program through 2023. I know that this investment is well worth it. I've seen the amazing work you're doing in our underserved communities. This training changes the lives of your patients and your own approach to medicine. And I'm so proud to be your partner. Congratulations again on your graduation. Enjoy the celebration. You've earned it.
Hi everyone, I'm Candice Chen. I am a very proud member of your GME board. And first off, I just have to say congratulations to all of you for this really important moment. But it feels even more important given the last year. About 10 years ago, I had the opportunity to provide some technical assistance to policymakers working on healthcare reform. And they were interested in three things. 1, primary care. 2, residency training. And 3, community-based training. And I think that those policymakers knew that for the Affordable Care Act to be successful, not only would we need more of these high-need physicians, but we really need better physicians. And out of those discussions, the Teaching Health Centers program was born. Over this past year, it's been my absolute honor to sit on your GME board and hear how all of you have been responding to the COVID pandemic and to the racial equity movement. I think that you have more than proven that the architects of the THC program were right. But even more importantly, you've demonstrated what it is at the true heart of medicine. The commitment to serve, your commitment to communities, and your mission. So I am just so pleased to be able to provide my congratulations on your graduation, but also I want to say thank you. Thank you for your service over the past years, really, and thank you in advance for, I think, the really important contributions that each of you will continue to make to your patients, to your communities in the years to come. Congratulations.
Good afternoon. I'm Dr. Melvin RubinFeyer. I'm a professor of internal medicine and head of the preventive cardiology program at the University of Michigan. It's my really great pleasure to be here representing Authority Health, and I'm one of the co-chairmen of the Graduate Medical Education Program for Authority Health, and very proud to be in that role. I can't tell you how excited I am for you and the work that you do. I've been involved in the care of people in Detroit for many, many years, including a nonprofit organization that began during the major crisis in the between 2006 and 2012 or 13. And what we saw was health disparities, the poor without adequate food, poor education programming. And this nonprofit began to look at the health and wellness of those people living in Detroit. And it was at that time that I joined the Wayne County Health Authority group, and then eventually became part of the Graduate Medical Education Board. I did that because our graduates are doing more than essentially any other cohort of graduates in healthcare, because you're addressing the real issues in our urban health programming. And that is the health disparities. You're looking at social determinants, and you looked at them many years before the general cardiology and internal medicine and family practice programs did. You're more needed than any other cohort of healthcare professionals because you serve in the rural communities, in the urban communities, and you focus on what's most important. And that's the basic needs of health literacy and changing the health disparities. I welcome you to our profession and your careers, and I wish you all the best in everything you do. And thank you for all the efforts you're going to be making in the future.
Hello, everybody. On behalf of Michigan State University and the College of Osteopathic Medicine at Michigan State University, it's my honor and privilege to congratulate each and every one of our graduates today at this time of celebration. A lot of hard work obviously has gone into making this day possible throughout the many years you've been in training, either from medical school or now in a residency or a fellowship program. And also kudos to your families, friends, loved ones, all the support frameworks you've had in place these many years, and many of you are in attendance today as well. And we want to thank you for your support. Truly is an honor for us as a medical school here to also have participated in your education during these past years. We really think it's a tremendous accomplishment that is being acknowledged for you today. And we're very happy that we were able to participate, not only in your training, but also in today's events. Even though it is virtual for us, we're still there in spirit with you, and congratulations, graduates. And don't forget, go green. Take care.
I would like to extend my sincere congratulations on behalf of the University of Michigan on completing your residency. It represents a singular professional achievement and a critical milestone in your training as physicians. I've met and spoken with many of you previously, but I am Matthew Bolton, Senior Associate Dean and Professor of Epidemiology at the University of Michigan School of Public Health. I've had the distinct pleasure of serving as the Faculty Director of the Certificate in Population Health and Health Equity, which all of you have completed. I want to encourage you to stay connected with the certificate program and let us know if there's additional training you would like to receive as alumni of the program through the Michigan Public Health Training Center. The certificate program has now finished training the 4th cohort of Authority Health residents as an important measure of its success. Over the past year, the current group of residents have learned about the social determinants of health, health disparities, and health equity in the context of population health, which are concepts I never heard about when I went through medical school and residency in the 1980s, but now form such an important conceptual framework for the work that we do as physicians. As you all go out into the professional world as doctors, we ask that you continue to explore ways, both large and small, that you can be a change agent in the communities you serve. You're tasked with building partnerships with other professional and community sectors to address difficult issues we discussed in the certificate program, like access to care, transportation, housing, food insecurity, and racism, among many others that are too often considered outside the purview of medicine and doctors. And we hope you feel empowered to contribute to community health assessments conducted by health systems or your local health departments, because we desperately need more physicians to be involved in those activities, especially in using local data to provide needed context about the communities where your patients work and live. We know that most patient-provider interactions almost always operate under a tremendous time crunch, so you'll have to make the most of those encounters. However, you now have the skills and knowledge to ask patients the right questions that inform about the social determinants of health and enable you to connect with your patients with resources and programs in the community that will promote health, prevent illness, and improve the quality of their lives. And for many of us, that is what being a physician is all about. Thank you and congratulations again.
Hi, I'm Dr. Kia PitmanHunt. I'm the Associate Designated Institutional Officer of the Authority Health Graduate Medical Education Residency Program, and I'm going to present both the Chief Residents and the Institutional Chief Residents. The Authority Health Chief Resident is a peer-selected position. Each residency program has 1 or 2 chiefs per year. Residents are chosen for their dedication to academics and education, for their strength as leaders, and as trusted representatives both of their programs and, most importantly, their colleagues. I'm going to start by acknowledging the Family Medicine Chief Residents, Shubi Kalwani and Elizabeth Hubble-Bevier. The Internal Medicine Chief Resident is James Vu. The Pediatrics Chief Residents are Gadir Ketado and Raksha Hemant.
Psychiatry, Carolyn Galden and Nisha Sheth.
Of our Chief Residents, Gadir Ketado and Shubi Kalwani act as our institutional chief residents and represent the residents across all programs.
Hello, my name is Cathy Smart, and I am the Family Medicine Residency Coordinator. On behalf of Authority Health's Graduate Medical Education's Residency Coordinators, we hope that your journey at Authority Health will be a memorable one. Each day in residency brings new challenges and learning opportunities. The type of challenges and learning opportunities that has hopefully prepared you for your career in medicine. Be it family, internal, pediatric, or psychiatry medicine, you chose to pursue a career in medicine because you wanted to make a difference by helping people and making a positive impact on their lives through healthcare. At times, it may have seemed as if the world was on your shoulders and that time was not on your side, or what you thought would be did not turn out to be what you expected. Despite any troubling moments you may have had to endure during your time in residency, the accomplishment of making it to the end outweighs those obstacles. You brushed the dust off your scrubs and continued to honor Authority Health's mission to improve the health of the medically underserved of Detroit and Wayne County. The year 2020 affected our lives in ways that we could have not imagined. So many lives were lost, but because of your passion and dedication, so many lives were saved. Although our job as coordinators comes with its challenges, it is a rewarding experience. It's nothing more gratifying than walking this journey with a group of physicians who will be setting out on their own to make a difference in the lives of many by providing various types of healthcare to individuals of all ages. Your hard work is and will always be greatly appreciated and remembered. With that, we extend our warmest congratulations to you, as it has been an honor to work with you over the years. Good luck to you all as you enter the next chapter of your career in medicine.
Hi, my name is Gerald Carlos. I graduated in 2019 from family medicine here in the Authority Health program. First and foremost, congratulations to Authority Health, the class of 2021. All that hard work you put in through undergraduate medical school, now you can put in the bag, residency, has all come out to this. I want you to be proud today. I want you to know that the time you spent at Authority Health, at Children's Hospital, and at the Detroit Medical Center was all worth it. Despite all the difficulties, despite all the imperfections, and despite of working in a program that is relatively new, I want you to know that it was all worth it. The most important thing to know, that despite finishing undergraduate, medical school, and residency, is that the work is not finished. We still have many things we have to do. I hope and pray for you that this is not your peak. I had a high school teacher whose advice to our class was to not peak in high school. Well, my advice to you today is to not peak in residency. As doctors, as potential medical leaders, being trained in a program directly working with the underserved of Detroit, where we see the problems of healthcare in the United States, where we directly see correlation with zip codes and health outcomes, where we see the impact of being uninsured and underinsured, and also especially through how hard our community was hit during the COVID-19 pandemic, we can see that there's still much to do. I don't want this to be the end for you. I don't want you to have peaked. I want you, after graduating, to get out there, take risks, to get involved, to make it difficult for yourself. I know y'all worked so hard to get to where you are right now. I know how much time you placed, how much training, and how much of yourself you have sacrificed. But as a medical doctor here in the United States, you have such great opportunity to do good in the world. I don't want you to undervalue that. I only graduated 2 years ago, so I can relate to a lot of things that you're thinking about right now, such as loans to pay, having a family, moving on with your life. But within these past 2 years, I just really saw how much of an impact being fully present in a community can be. My first job after residency was to act as a medical doctor with Doctors Without Borders. I ended up working for 6 months in South Sudan, primarily working with HIV, tuberculosis, and hepatitis patients. But because of the context and how understaffed we were, we had to be prepared to catch babies, work in the newborn and pediatric wards, and manage all sorts of patients. With that opportunity, I saw how much of an impact I can make by just being fully present and available for that community. You don't have to have all the answers. You don't have to be the smartest or the most prepared. What I learned was that you just have to be there. You got to be fully present, be fully engaged, and be willing to work hard each and every day. After those 6 months in South Sudan, I came back home to the United States in the beginning of the COVID-19 pandemic. So I placed myself in the middle of rural Arizona in Navajo Nation, where in June 2020, the Navajo Nation had the largest per capita infection rate in the United States, surpassing any other individual states in the Union at that time. And finally, during these past 6 months, I came back a little closer to home, working in an outpatient setting in an FQHC in South Chicago, Illinois. I didn't have all the answers. I wasn't the smartest or the most prepared. In fact, I was probably a little over my head taking on these projects. But I learned so much. And most importantly, I learned how much an impact I can make in a community by just being there for them, being present, being fully engaged, asking the right questions, finding the right resources, and knowing what my weaknesses are and strengthening what I know. So this is my call to you. Let this not be your peak. You now have the knowledge and the potential to make a huge difference in this world. Being a doctor is a right and a privilege. Don't take that for granted. Use this life and use what you know for other people. Take risks, take major challenges, take leadership roles, make it difficult for yourself. Get your hands dirty, make mistakes, and learn from them. Know when you're wrong and be a strong advocate for your patients. Take responsibility, and finally, be someone that people want to look up to. Thank you.
Welcome, graduates and families. My name is Dr. Wendy Bessler, and it is my immense privilege to give this address to the graduating residents of Authority Health Class of 2021. I know we have been waiting for this day for 4 years, and it's finally upon us. Maybe not as we had initially hoped to spend it, in direct contact with each other and our loved ones, but we have proven ourselves resilient as we have worked around this obstacle and multiple others as well over the past 4 years. Constant obstacles and challenges are a consistent part of our chosen profession and may have brought many of us into the practice of medicine. There is nothing more satisfying than diagnosing an illness and giving treatment that resolves a patient's suffering and pain. As we venture into our future as physicians in a variety of specialties, we are now going forward armed with the information that we have been taught, and more importantly, the experiences that we've had. This is officially our time to shine. This is our time to change the world of medicine for the better. Every one of us have had experiences that we thought a different diagnosis, a treatment, or a different therapy would benefit our patient. It may even be if that treatment could be applied in a distinctive manner or just tweaked. Don't ever let anyone tell you that it can't be done or accept just the status quo. If you know there's a better option, treatment or diagnosis that will help your patient, fight. Fight for each patient as if they were your own family member. In many cases, they have no one else but you looking out for them in a system that's overrun with pitfalls, insurance constraints, and multiple other limitations. One of my favorite quotes is from Albert Einstein, who said, "Great spirits have always encountered violent opposition from mediocre minds." Never be afraid to fight for your patient's health. Allow your knowledge and wisdom to lead you. We as physicians have the ability to impact a patient's life, not just through the administration of medications, but also through the simple act of caring and listening to their concerns. That is our gift. I believe I would be amiss if I did not mention the pandemic that we have all suffered through as a nation. I was incredibly proud of the Authority Health Residency program and our quick response to the pandemic in our community. I was happy to be able to stand with numerous others in different church parking lots side by side with my fellow resident volunteers, Dr. Yoder, our fearless leader, Mrs. Bush, and numerous others performing nasopharyngeal swabs on patients through the windows of their vehicles in some of the most inclement weather that I've ever experienced in Michigan. I believe my favorite memory is when we realized that we could not possibly complete all of this COVID testing on the numerous cars that were lined up as far as the eye could see in the middle of a torrential downpour. But we looked at each other, grabbed kits and umbrellas, and went from car to car until every patient had been tested, including the lady who accidentally rolled her window up on my arm as I had a nasopharyngeal swab halfway to its target. Unfortunately, many of us have also suffered the loss of friends and family and coworkers to the virus, which continues to be difficult for all of us to manage. Please always remember that our loved ones will never be forgotten, as they will always remain alive and well in our memories, our thoughts, and prayers. My amazing parents always encouraged me to look for the positive in every experience, and I do believe this virus has solidified our commitment as physicians to the health and well-being of our patients and the importance of true preventative medicine. We no longer are only treating our patients' illnesses, but also preventing those that we can with encouragement and counseling for a healthy lifestyle, including good nutrition, exercise, and nutrient supplementation. Years ago, when I was practicing as a neurology PA, I had a patient that I saw almost daily in an extended care program in a hospital. She was a very young woman who had a brain tumor, a glioblastoma multiforme, a very aggressive tumor with a high mortality rate. Due to its location, her prognosis was bleak. She was delusional, but thankfully, happily delusional. Every time I walked into her room, I would ask her what she had done the day before, and she would happily tell me that she had gone out with friends the night before and had a wonderful time socializing and traveling around town. She was always happy and upbeat. The day came when I entered her room, as I had done numerous times before, but this time I found her crying. She asked me why God would have allowed this to happen to her. She was completely cognizant of her disease state and her chances of survival. It was horrible. I fought back tears and sat on the edge of her bed and just talked to her. I have no idea how long our conversation was, but when I left, she hugged me and thanked me. I remember thinking, how could she possibly thank me? I had no options for treatment and no hope to give. All I could do was listen. When I left her room, I tried desperately to wipe tears from my eyes so the staff would not know that I had been crying. I didn't want to be perceived as unprofessional. It spread quickly as many of the staff saw the state I was in when I left her room. I had multiple staff members approach me afterwards, stating they were glad to see my reaction, as so many had experienced the same emotion. But we were all trying to hide it in order to fit what we thought a professional response should be. My patient passed away the following morning without ever knowing how she had brought together and positively impacted multiple staff members that cared for her. Wisdom will come to you in the most unlikeliness of sources, many times through failures. There will be days that will bring you to your very knees, days where you feel incredibly inadequate, and even days that cause you to question your very purpose in medicine. But how you respond to these challenges will determine what kind of practitioner you will be. I once heard a saying, if you are going to fall, make sure you fall on your back, because if you can look up, you can get up. We now go into the world with the amazing ability to apply our knowledge for the betterment of patient care. We will now stand completely on our own 2 feet, fully realizing that our patients' care now lies within your hands and in your hands alone. This can be overwhelming, but also bring tremendous joy. For each of us will have our own patients that we will follow throughout our careers. We will watch them grow and develop and achieve their goals and dreams. We will have the privilege of being part of their lives. Thankfully, our job is one of the only professions that does not require any type of judgment of those we treat. I never have to judge a patient based upon their past, their race, their ethnicity, their life choices, or sexuality. It does not matter if they spent years in prison or own a major corporation or both. All I have to do is determine how best to prevent and treat illness in that individual. We will see patients from every walk of life, but our only goal is to determine what efficacious treatment and to deliver it in a caring and supportive manner. All we have to do is truly care for our patients. We are so incredibly fortunate to have been given this opportunity to step into the most prestigious profession, the ability to provide physical and mental health care to individuals. What greater calling could possibly exist than providing healing and symptom resolution to those that we have been called to serve? I wish you all the best in the amazing future that awaits each and every one of you. Thank you.
Hi, I'm Dr. Hussein Sennar, Family Medicine Program Director. Time, sympathy, and understanding must be lavishly dispensed but the reward is to be found in that personal bond which forms the greatest satisfaction of the practice of medicine. One of the essential qualities of the clinician is interest in humanity, for the secret of the care of the patient is in caring for the patient. This quote from Dr. Francis Peabody comes to mind when I think of our graduating family medicine class of 2021. You've been through a lot over the past few years and have shown a great deal of perseverance and leadership as you helped this program develop into what it is today, a place of inquiry, offering training in excellent patient care, public service, and leadership development. But more importantly, you've created a program that has become a surrogate family to many here. One thing you never lost sight of was your commitment to the community we serve and also to one another. You are leaving this program in better shape than when you joined it, and in the process, you have served as a great example for future classes. Thank you for the grace, dedication, and leadership that you demonstrated while working tirelessly through the pandemic. On a personal note, you've been a joy to work with and have helped me become a better program director and physician. You should be proud of the work you did in this program and the tradition of excellence you've created. I know each one of you will continue to be a champion for health equity, compassion, and social change throughout your careers, and I rest assured our profession will be in good hands as a result. Thank you all, and congratulations to you and your families on this special day and on your momentous achievement. And in the spirit of Peabody, continue to manifest that the secret of the care of the patient is indeed in caring for the patient, just as you have all brilliantly done in your time at Authority Health. Dr. Kyle Babinski. Dr. Babinski will be joining Piedmont Healthcare, Lake Norman Family Medicine Practice in Mooresville, North Carolina. Dr. Hassan Bazzi. Dr. Bazzi will be joining Elite Care Physicians, which is a family practice in Allen Park, Michigan. Dr. Elizabeth Bevier. Dr. Bevier will be joining Centricare St. Cloud Medical Group North in St. Cloud, Minnesota. Dr. Ashley Kotz. Dr. Kotz will be joining Alcona Healthcare, which is an FQHC in Lincoln, Michigan. Dr. Shubi Kelwani. Dr. Kelwani will be continuing her education by pursuing a Women's Health Fellowship at the University of Michigan in Ann Arbor, Michigan. Dr. Jasbir Singh. Dr. Singh will be continuing his education by completing a sports medicine fellowship at Drexel University in Philadelphia, Pennsylvania.
Hi, I'm Joel Apple. I am lucky enough to be the program director in internal medicine for the Detroit-Wayne County Authority Health program. And it's my pleasure today to announce the names of our two graduates. These are graduates who have been a major leader in our residency, being limited to only two in this particular class, and the challenge of being the mentor for so many others in the ranks below them. In a very, very challenging year where, as we all know, for all programs, COVID has cut into so many opportunities with our seniors, particularly in the area of electives and being pulled to the hospital for ICU and floor coverage. It's been extraordinarily challenging. But our two graduates, like the rest of our Authority Health class, have really stepped up and committed themselves to doing the right thing. The first graduate is Dr. Samra Huda. And Dr. Huda will be practicing as a nocturnist, essentially an evening hospitalist within the Wayne State University School of Medicine system on the central campus. Our other graduate is Dr. James Vu. James will be leaving us for sunnier climates in Florida and will be practicing ambulatory-based medicine at the Villages in Florida.
I'm Dr. Kia PitmanHunt. I am the Pediatric Residency Program Director, but I first want to start by congratulating all of the Authority Health graduates today. You made it. Congratulations. I'm so proud to present my 7 graduates today. These women represent the best of Authority Health. They are one of the strongest group of women that I've had the pleasure of working with. They are outstanding clinicians, fierce advocates for their patients, and have a drive for academics that has moved our program forward by leaps and bounds. I want to thank them from the bottom of my heart for their hard work and for the last 3 wonderful years. I'm so proud to be your program director and hope that we will remain colleagues and friends for a very long time. Without further ado, I would like to start by presenting Christine Hart. CJ will be joining a private practice in Southeast Michigan, and she's also starting an osteopathic manipulative medicine consult service at the Children's Hospital of Michigan. Raksha Heyman. Raksha will be joining a private practice at the Medical Center Pediatrics in Southeast Michigan. Gadir Kitado. Gadir will be staying with us at the Children's Hospital of Michigan as a fellow in hematology oncology. Lauren Ludstrom. Lauren is joining a private practice at Fairview Range Medical Center in Hibbing, Minnesota. Erica Oliver will be completing a pediatric critical care fellowship at Washington University at St. Louis. Soha Sheikh will be doing private practice at Serenity Pediatrics in Southeast Michigan. And last but not least, Kristen Weider will also be joining private practice at the Michigan State University College of Osteopathic Medicine Pediatric Group.
Hi, I am Dr. Dia Carey, and I am the Psychiatry Program Director here at Authority Health. I have to congratulate my graduates on how they have navigated this last year in the middle of a pandemic. I am in awe of their response to the community and their attention to their studies to successfully graduate our program. Our first graduate is Zaid Baha. Dr. Baha, after graduation, will continue to work at Chanel Psychological Services, providing services here in Michigan for those that are pre-trial or post-conviction and also have mental health services. Dr. Baha also plans on building his own private practice. Our next graduate is Dr. Wendy Bessler. Dr. Bessler is opening a private practice called Advanced Neuropsychiatric Specialist. It is going to unify neurology and psychiatry in Farmington Hills, Michigan. She will also continue to work in community mental health services at Clinton Counseling Services, as well as she will take a job as the medical director for Saturn Science, which is an addiction medicine clinic in Detroit. Our next graduate is Dr. Ibrahim Dagger. Dr. Dagger plans on working with Happier Living as a telepsychiatrist. He will continue to reside here in Michigan, and he will see patients from 5 different states, including California, Michigan, Texas, New York, and Florida. Our next graduate is Dr. Neda Habib. Dr. Habib has yet to determine which job opportunity she will take and where her and her family will reside following graduation. Our next graduate is Dr. Arif Patel. Dr. Patel will continue to work at the Guidance Center here in Michigan, providing telehealth services. He plans to move back to his home state of New Jersey. Our next graduate is Dr. Jennifer Rostamabadi Cook. Dr. Cook will work as an outpatient psychiatrist at Pine Rest Traverse City Clinic. In addition to her clinical duties, she will be involved in teaching and supervising medical students and residents with Pine Rest Psychiatry Residency Training Program.
I'm Camille McKinley, the GME Program Manager. I would like to take the time to thank everyone for joining us for the Authority Health virtual graduation. Although times has changed and due to the pandemic, we are doing a lot of things virtually, we wanted to take the time to recognize all of our graduates and celebrate them on this day. On behalf of the GME staff and the rest of Authority Health, we wish you all the best on your next journey in life. Congratulations, class of 2021.
Hi, everyone. I'm Dr. Carolyn Custer, Director of Quality in Community Medicine. To the graduating seniors, you're finally here at the end of the road. Your class went through some really challenging times, yet you persevered and made it, and you completed your scholarly activity requirements. It's been a pleasure to work with you, teach you, and watch you grow over the years. Some of you I only saw at didactics, others I worked with closely over years. Either way, your time as a resident is appreciated, and I wish you all the luck in your career and moving forward in your life. Always remember PDSA. Now, stay tuned for some congratulatory videos.
Hello, I'm Janieri Neal, Program Manager of the Certificate in Population Health and Health Equity. And I'm here to congratulate you on completion of your program and to thank you for taking so seriously the certificate program that we offered to you over the last several months. I think what we've provided to you is really a drop in the bucket of all the things that you need to know and think about and consider as you pursue your careers as physicians in the community. So I urge you to continue to explore the community, to learn about community resources, and to continue to listen both to your colleagues, to your community, but most importantly to your patients so that you can always offer them the best quality of care in a very personalized manner. Again, congratulations, and thank you very much for your attention over the last several months.
Hello, everyone. I'm Maria Gilson, Program Assistant with the Certificate Health, Population Health and Health Equity, along with Janieri and Matt and Laura. And I just want to extend my congratulations to all of you and wish you well and know that we're going to be watching what you do in the future. Congratulations.
I close my eyes and I can see a world that's waiting up for me.
Hey, Dr. Kotz. Me and my friend Frank just want to congratulate you and your co-residents on completing medical school and now residency. It is a tremendous accomplishment to be proud of, and I wish you all the best of luck.
Congratulations, Ashley! We are proud of you and everything that you've accomplished.
Now all your friends and family will ask you for free medical advice.
We are so proud of you and we love you so much.
I am so proud of you and want to tell you congratulations. You did it!
Hey Ashley, it's Tim and Susie. Just wanted to congratulate you on your graduation. It's really cool having a doctor in the family, especially when I get old.
Congratulations, Ashley.
Congratulations, you did it!
Super proud of you. Congrats.
We love you.
Congratulations, Beth. So proud.
Congratulations, Elizabeth. Love you very much and very excited for your accomplishments.
Congratulations, Elizabeth. I'm so proud of you and excited of all of your accomplishments, and I can't wait to celebrate with you in person. I love you so much.
I love you, Elizabeth. I'm really proud of you. Good job.
Congratulations, Elizabeth. I love you and I'm so proud of you.
Hasundi, let's go. Undefeated, never lost. Hasundi!
Dr. Cherries.
Congratulations, Hassan.
Hi, Dr. Cathy.
Congrats, bro.
Congratulations, Hassan.
On finishing your residency.
You freaking made it.
Congratulations, Hassan.
Congratulations, Hassan.
Congratulations, Dr. Friend.
So much love from Chicago.
Hassan! Congrats!
We're all so proud of you.
I'm so happy for you.
You were born to be a doctor.
I'm so freaking proud of you. I've witnessed firsthand how hard you've worked over these past few years.
Can't wait to hear all the stories about how you've turned all of your patients into Cycle Bar members in the future. I know you're going to do amazing things.
You deserve nothing but the best things coming your way. I love you so much. Mabruk!
We love you, man.
You made me a proud mother.
You're going to be an awesome doctor, and I can't wait to see you shine.
On to the next chapter of attending life.
Now go make that money!
Congrats on graduating, Pietro, dear. We love you so much. We're so proud of you, and good luck to you in your fellowship.
Congratulations, Lydia. We're so proud of you. Yay, send your kisses.
Congratulations, Ghadir, for finishing your residency, and soon you will be starting your fellowship with Pete's Hem-Onc. I wish you did adult Hem-Onc like myself, but that's fine. Pete's Hem-Onc is very good.
Congratulations, Ghadir. We are so proud of you. We love you.
Congrats, Lydia. We love you. We're so proud of you. I can't wait to do your psych assessments on all your patients after they're done with you. Congrats, Lydia.
Is there a doctor in the house?
Yes, there is.
Dr.
Lauren
Lundstrom.
Lundstrom. Congratulations.
Very proud of you and hope that you are successful in all your new endeavors.
Congratulations, Lauren.
We love you. Congratulations.
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 Yay, we're so proud of you, Dr. Lauren.
Congratulations, Lauren.
Congratulations.
Congratulations.
Congratulations, Lauren. We are incredibly proud of you.
Lauren, we're so proud of you becoming the first doctor in the family.
Congrats, Auntie Lauren.
Hi, Lauren. Congratulations on all your hard work.
Congratulations.
I am so very, very proud of you.
A big, huge congratulations. I love you forever.
You surpass every dream I've ever had for my daughter. Love you.
Lauren, fantastic job. I'm so proud of you. Congratulations. Woohoo!
Congratulations, babe. JoJo and I love you so much.
Mwah.
We love
you, Kristen.
Hi, Soa. Congratulations. You finally did it. You're going to be a pediatrician in just a few weeks. We're all so proud of you, and I'm so happy that you're able to multitask, raise Isla, support me, and become an amazing pediatrician. We're also excited for what the future will hold for you, and I'm very happy to be a part of your life.
Congratulations, Soha. I'm so proud of you. I'm happy you're carrying on the family tradition. One pediatrician to another, I think you will have a great time.
Congratulations. I'm so proud of you, Mama.
We have an amazing daughter who has a heart of gold for anyone that comes to her for help.
Congratulations, Wendy, and always stay as personable as you are.
Congratulations, Wendy. You deserve the best. Love you.
Just thank her for everything she's done for me, and especially the rest of the family over the years. You don't get enough praise. Love you, Aunt Wendy.
Hi, Aunt Wendy. Congratulations on graduating from residency. I love you so much.
Congratulations, Wendy, on your graduation from residency. We are so very proud of you.
All right. Our next award is for Best Doctor. And the award goes to
Dr.
Wendy Bessler. You rock, girl. You're awesome.
I'm very proud of you, and I love you, Wendy.
Dr. Bessler.